You've seen vitamin B12 everywhere, right? It's on cereal boxes, it's in energy drinks. It's the one vitamin we all know is super important. We know it's essential. But what if the real story about B12 isn't about getting enough of it, but about the hidden danger of having way too much?
Think about it. It kind of goes against everything we're taught about vitamins. More is better. But what if seeing a high level of B12 in your blood wasn't actually a sign of great health, but was instead a red flag for something much more serious? Well, that is the incredible paradox we're going to unravel today.
So, to really get our heads around this paradox, we've got to start with the basics. What exactly is vitamin B12, and why do we call it the body's master key? So here it is. This is cobalamin, which is way better known as vitamin B12. It's this big, complex, water-soluble vitamin. And right there in the middle, that's a cobalt atom, which, you guessed it, is where the name cobalamin comes from. Now, what's crucial here is that our bodies can't make this stuff. We absolutely have to get it from our food, and that means mostly from animal products. Okay, so what does B12 actually do? Well, it has two absolutely critical jobs. First, it helps build and repair our DNA. You can think of it as part of the essential maintenance crew for our entire genetic code. And second, it helps our cells turn fats and proteins into actual energy. So the bottom line is this. Without B12, our bodies can't properly create new cells, and they really struggle to power themselves.
Right. Now let's talk about the side of the story we're all a bit more familiar with, deficiency. What happens when that B12 tank starts running low? And this is a huge deal. It affects up to a quarter of the population, making it a major health concern all over the world.
So who's most at risk here? Well, older adults often have a harder time absorbing it from food. Vegans and vegetarians absolutely need to supplement since B12 just isn't found in plants. And then you have folks with GI disorders or people who've had bariatric surgery. They can really struggle. And get this, even really common medications like acid reducers or metformin can stand in the way of your body getting enough.
And the consequences of deficiency, they are serious, and they are surprisingly all over the map. We're not just talking about feeling tired. It can lead to some severe issues, everything from anemia to major neuropsychiatric problems like memory loss, nerve damage, and even psychosis. It can mess with your blood, your gut, and your brain. It's no joke.
Okay, so if your levels are low, you obviously need to fix it. But what's the best way to do that? For decades, this question has sparked a huge debate in medicine. Are pills better, or do you need shots? Let's see what the science actually says.
The question seems so simple, but the answer has been, believe it or not, pretty controversial. When a patient needs more B12, what's truly the most effective way to get it into their system?
So on one side of the ring, you've got your oral supplements. They're cheap, they're easy, no doctor's visit required. But the huge question has always been, do they even work if your gut has trouble absorbing B12 in the first place? Then, in the other corner, you have intramuscular injections, the shots. They bypass the digestive system completely, which is why they've always been considered the gold standard. But they can be painful, they're more expensive, and they're just plain inconvenient.
And here is the twist. A massive meta-analysis published in Frontiers in Pharmacology crunched all the numbers from 16 different studies, and they came to a pretty stunning conclusion. Oral supplements seem to work just as well as shots. Yep, it turns out that even for people with absorption issues, high-dose pills can get the job done, which totally challenges decades of medical dogma.
Okay, so we know how to fix low B12, but that's only half the story. Now we're going to pivot to the most surprising part of this whole thing, the hidden danger of having too much. This is the question that just changes everything. You see, since B12 is water-soluble, the assumption has always been that any extra just gets harmlessly flushed out of your body. But what if high levels aren't from taking too many supplements, but are actually a signal from your body that something else is seriously wrong?
So recent research is now showing a strong and frankly pretty alarming link between unexplained high B12 levels and a bunch of very serious diseases. We're talking solid tumors, blood cancers, advanced liver disease, and even kidney failure. Now in these situations, the high B12 isn't the problem itself. It's a marker. It's a biological clue that one of these other conditions might be lurking.
So how do doctors use this discovery? Well, they've developed a clever tool called the BCI index. It's actually a pretty simple calculation. You just multiply a patient's B12 level by their C-reactive protein level, or CRP, which is a standard marker for inflammation. That one simple number can give a powerful clue about a patient's prognosis.
And this is where it gets incredibly stark.
A BCI index over 40,000 is a powerful predictor of a very poor outcome. In fact, one study found it was associated with 90% mortality within just 3 months for certain cancer patients. A routine vitamin test, when combined with another standard blood test, can suddenly provide critical life or death information.
So after all of that, what are we supposed to do with this information? We've seen that too little B12 is bad, and now we know that too much B12 can be a warning sign. It really is all about finding that right balance.
Here's the main takeaway. Vitamin B12 is a total double-edged sword. Deficiency can cause irreversible damage, there's no question, but unexplained high levels can be a major red flag for serious underlying disease. It's a true Goldilocks vitamin. You don't want too little, and you definitely don't want too much. You need it just right.
All of this really leaves us with one final big question. Maybe it's time we stop thinking of vitamins as just these simple, good things that we get from food and start seeing them for what they really are: complex, powerful molecules that can tell a much, much deeper story about our health.